Are you thinking about starting Ozempic? Before you take that first dose, there are a few serious safety warnings you really need to know. Some are rare, some happen more often than people realize. And being prepared could make all the difference. Let us go through it so you feel more confident and know what to look out for. I'm a licensed pharmacist, and this is Pharmacist Online. I take complicated health topics and make them simple and easy to understand. In our last video, we talked about using Ozempic with insulin to help lower hemoglobin A1C, but now let us talk about safety. Because understanding how a medication works is only half the story. Knowing how to use it safely is just as important. So let us start with the most serious warning first. Ozempic may cause thyroid tumors. That includes a rare kind of thyroid cancer called medullary thyroid carcinoma, also known as MTC. Now, this warning comes from studies done on animals, not humans, but the risk is serious enough that it is printed right at the top of the label. So, here is the rule. If you, or anyone in your family, has ever had MTC or a genetic condition called MEN2, which stands for multiple endocrine neoplasia type 2, you should not use Ozempic. And if you ever notice a lump or swelling in your neck, those could be signs of a thyroid issue. Now, let us talk about who else should not be using Ozempic. You should not take Ozempic if you are allergic to semaglutide or any ingredient in the injection, you are pregnant or trying to get pregnant soon, you have had pancreatitis before, you have a condition that slows down digestion, like gastroparesis, or if you have diabetic eye disease, especially if it is moderate to severe. Also, always let your doctor know if you are taking insulin or medications called sulfonylureas. When combined with Ozempic, those increase the risk of low blood sugar, and we will talk about that in just a second. Let us walk through the serious side effects now, because these are the ones you should not ignore. First up, pancreatitis. That means inflammation of the pancreas. If you ever feel severe pain in your upper belly that does not go away, especially if it comes with nausea or vomiting, call your doctor. That could be pancreatitis, and it needs medical attention. Next, vision changes. If your eyesight gets blurry, or if your diabetic eye disease suddenly gets worse, do not wait. Get it checked. Then there is low blood sugar, which is more likely if you are using Ozempic with insulin. Watch out for signs like shakiness, sweating, dizziness, fast heartbeat, confusion, or blurred vision. Kidney problems can also happen, usually from dehydration caused by too much vomiting or diarrhea. So staying hydrated is really important while taking Ozempic. There is also a risk of gallbladder issues. If you notice pain in your upper right belly, yellowing of your skin or eyes, or pale-colored stools, those are red flags. Call your doctor. Some people also experience serious digestive symptoms, like ongoing bloating or stomach pain that just will not go away. That is not something to push through. Let your provider know. And here is something a lot of people do not think about. Ozempic slows how fast your stomach empties. So if you are having surgery or any procedure that uses anesthesia, make sure your doctor knows you are taking Ozempic. That can affect how your body responds. Okay, now that we have covered the serious stuff, let us talk about what is actually most common. When people first start Ozempic, or when their dose increases, they often feel nausea, vomiting, diarrhea, constipation, or stomach pain. For most people, these symptoms get better with time. A good tip? Take your dose after a meal and drink plenty of water. That can make a big difference. So, what is the big takeaway here? Ozempic is a powerful medication. It can help lower blood sugar. It can support weight loss. But like any medication, it comes with risks. Knowing the side effects, both the serious ones and the common ones, can help you catch problems early and feel more confident while using it. Have you had any side effects with Ozempic? What was your experience like? Drop a comment and let others learn from your story. It can really help someone who is just starting out. And in our next video, we are going to talk about the foods, habits, and routines that can actually make Ozempic side effects worse, and how to avoid them. Trust me, you will want to know this. So hit that subscribe button so you do not miss it. If this helped you feel more prepared, tap that like button and leave your questions down below. And remember, subscribe to Pharmacist Online for more clear, honest, and real-life health advice you can actually use. Thanks for watching, and take care of your health.